officially calling the meeting to order of the Health, Hospitals, and Social Services Committee. We have Gilmore, who's present, Hastings, Hurt, Sledge. So we will begin. The first resolution is 2018-1140. So the sponsors are Vercher, Mendez, and others. It approves a sub-recipient grant agreement between the Metro Development and Housing Agency and the Metro Department of Social Services and the Metro Homelessness Commission to provide service for homelessness persons, including funding for emergency payments for persons housed through the 100,000 Homes campaign and needs assessment and planning efforts. May I have a motion?
So moved.
Okay, so it's been moved and properly seconded. Is there any discussion? Not any discussion.
Is there someone here from the Homeless Commission?
Oh, okay, yeah, so please come forward, and you are a new face. I think we were looking for Judith Thackett.
Yeah.
I'm her assistant director. My name is Abigail Dowell.
Okay, Abigail.
Nice to meet you all.
Pleasure. So you could probably just tell us a little bit about it. Now, we did discuss it in the budget and finance, but since you're here, we always like to give the opportunity of the directors or the assistant directors just to kind of do a I guess a reframing or just a overview, a summary. Thank you so much. Yeah, a summary of it.
Sure. Well, this partnership that we have with MDHA, and Shelley is here from MDHA, is that they are providing us funds from the Community Development Block Grant to basically reimburse some of the funding that we're using from the Health Nashville program to provide first month's rent, deposits, utility deposits, that sort of thing, so that people can move into permanent housing situations.
Abigail, this program only does the first month's rent and security deposit. It does not do utility deposits.
It does not do utilities? Because yesterday they said it did do utilities in budget and finance.
I think
Is this HOPWA funding? Is it going to be used for HOPWA?
No, this is CDBG funding. So this comes out of CDBG. It is first month's rent and security deposits only.
Okay.
So we may want to just clarify, because we had a really long discussion yesterday about it, and they told us that they said it was just one time,
It is just one time.
but they also said that it could be used for utilities as well as the deposits, and we just probably want to clear that up, because we did discuss that,
So
and this is on camera as well, but we discussed that on TV, and we probably just need to kind of clear it up either way.
Is it EFA funding?
No, this is Community Development Block Grant funding.
So it's no emergency, it's not for emergency circumstances, but just to provide assistance
Moving assistance.
for homeless.
Yes. One time up to $1,000.
Okay, so one more, I'm sorry.
No, you're fine. We'll recognize.
So if there was an individual who worked to get Section 8 funding, and they have the funding, but now there's no money available through Section 8, but they've been approved and certified, will this money be available to individuals such as that to help them with the...
Yes.
Okay.
Yes.
One time.
Yeah, it's a one-time thing. And as opposed to ESG funds that cannot be used, you could not use that first month's rent with ESG funds, Emergency Solutions Grant funds, for the rent, because that would be an extra subsidy. CDBG allows for that one-time payment of the first month's rent on top of the subsidy to get them in the apartment. So there is a term in the contract that it does say emergency, but it's more like trying to get that immediate assistance to the client for that one-time deposit and one-time first month's rent to help them get into housing.
Yeah, it was my understanding to get them over the hump,
Right.
to remove that barrier, but there are other resources available.
Right.
And they can be combined, I think
Right,
that's what
so
you're
the
saying.
ESG funds could step in and do the utility deposits, whereas the CDBG funds do the security and first month's rent.
That's probably,
Okay,
that's what I was thinking.
okay, yeah, we probably just need a little bit more
If I
clarity.
can, though.
Yes, ma'am.
I wanted to take the opportunity, since we're talking about assistance, and I see someone here from the Metro Action Commission. I know that there's opportunity now for applications on emergency electric bill funding. Can you speak to that for just a second?
Yes, that's the Marvin Cox, Community Programs Director for the Metropolitan Action Commission. That's the Low-Income Home Energy Assistance Program, and that is specifically on current and active bills. That is not for deposits.
And that application can be found where?
It's on our website. Also, individuals can walk in at 800 2nd Avenue North and make applications as well.
Great. It's an important thing that happens through the Metro
Mr.
Action
Cox,
Commission. So.
where are you from?
Metropolitan Action Commission.
No, I mean, where did you grow up?
Memphis.
Memphis, Tennessee?
Yes, ma'am.
Oh, okay. I just wanted to make sure that, people doing such great work, a lot of them come from Memphis, and I'm just, I just recognize.
So be it. Let's that's
That is correct.
call to order.
I know, I think we lost order.
Yeah, call to
Okay, I need to bring the meeting back to order.
The emergency assistance for that is an incredible opportunity for a lot of families. I know that it personally helped my family out in 2008, and so I like to point that out as often as I can.
And individuals do not have to be in a emergency or cutoff situation as long as they meet the income guideline as well. I think that's a misnomer that people think I need to be in a cutoff status or disconnected, but that's not true. So that's the word we're trying to get out, because we do have funds available, and we're trying to make sure that the Davidson County residents are aware of that service for them.
And so in the income guidelines, what are they?
For a person, a household of one, you're probably talking about $17,000.
Okay.
And then there's a sliding scale as you go up to that.
Okay, well, thank
And
you.
all that information is located on the back of the application as well.
Okay, thank you so much. And then I think with this program, I'll let you go ahead and speak. Yes,
I'm
ma'am.
sorry, I wanted to clarify one thing. I went back and read through the contract again.
And state your name, too.
I'm Shelley Fugit. I'm with MDHA, and I work with the CDBG program. I'm the Senior Development Specialist for CDBG program, so I do a lot of the invoicing and paperwork for this project. The contract does state security and utility deposits. I think where I was probably thinking incorrectly is, having done a lot of the invoices and reimbursements, the majority of what we see is strictly the security deposit and the rent. But the contract does say utility is also available. It's just typically we do not see them asking for a utility, because with that $1,000, the rent and the security deposit pretty much take up all of that anyway.
Yeah, and then so that's what I asked yesterday. I said I would like to see where these persons are moving, right? Because I think, just to kind of speak to your point, $1,000 is really, doesn't go far at all. So I think Ms. Stackett or Ms. Hubbard, one of them said they would try to get us that data, because is it just for the Nashville, Davidson County residents? Okay, so it's just, okay, yeah, so if we could just see that data, I think that would be helpful in the retention, because I still can't believe that somebody can really get in somewhere for
$1,000.
$1,000, right?
Well, I think what helps is if they are using a Section 8 voucher.
Okay.
Because this is the one time that you can kind of get that double subsidy. Normally you can't get the double subsidy.
Right.
I think that's where it helps, because if you're using that security deposit and first month's rent in line with the Section 8 voucher, it probably makes a bigger difference. And this is the only time that HUD allows that. Other programs,
Right.
deposits and everything, they don't allow it because they consider it a double subsidy. But for just this one-time payment, they will allow it under CDBG.
That's very good. Are there any more questions from the committee? And so the
I got one more question. Is this for the current consolidated plan, or is it for the one that,
This is for the current.
okay, all right, okay.
And then I think I just have one more question, and the question was, they find out this information from the navigators, or it's such a good program, so if we want someone to know where the persons that need these resources getting the information from, how do they get connected, right?
They're going through the housing navigators in the city at all the various service providers in Nashville.
Okay, and so can you just give me an example of where that would be?
Well, it could be through a program like Open Table that does outreach to people on the streets and encampments, or it can be through a program like Park Center or Mental Health Co-op. and where people go in to receive services most often. So those are just a couple of examples, but there are many others.
Okay, well, thank you so much. And give me your name one more time.
Abigail Dowell
Okay, it's nice to meet you, Ms. Dow. Are you relatively new to the?
started in October.
Okay, okay, well, congratulations. We're
welcome.
happy to see you. All right, and give me your name, please.
Shelley Fugate.
Shelley?
Yes,
Fugate?
Fugate.
Fugate.
Yeah, it's hard.
Okay, no, Fugate, it's a pleasure. So if there's not any more questions before the committee, I would say that we're ready to vote, right?
Yes.
How many are for? All right, seeing none against, it is recommended for approval. I always have to do a little count with my eye, if y'all wonder what I'm doing. I count in my head. So it's recommended for approval. Thank you, ladies. You did a very good job of explaining that program to us. Okay, so we'll move on to the next one. Resolution 2018-1145 sponsors Virture and Gilmore. It accepts a grant from the Tennessee Department of Health to the Metro Board of Health to provide core medical services and early intervention services to facilitate and support HIV/AIDS medical care. May I have a motion? Okay, it's been moved and properly seconded. We have discussion. Mr. Sharp, are you here to speak to this?
Captain Gilmore and members of the team, I'm sorry.
Run about.
And if I may preempt Ms. Hurd, I'm from Tullahoma. So this is a relatively small amount of funding. It will be spread around several, EIS. What's EIS?
Early intervention.
Thank you. And it's salary supplement so that they can continue doing connection to care, which is a thing that we have to work on all the time. We find somebody that's positive, then what? So we have to make sure we work real hard to get them connected to the treatment care.
Very good. And I always like to hear, so what type of agencies do these monies, because it's not necessarily health department, but is the health department dispersing the money to the agencies? Is it like a national?
This will be for health department employees.
Okay.
They'll
Okay.
be spread among, I can't remember how many, several. It's
Okay.
15% of their salary.
So do they go out into the community or, okay.
Yeah, and they work in the HIV and the STD areas to try to make sure. I think this funding is specific to HIV because it's ultimately, if you trace it back far enough, I think it's Ryan White money. It's been flowing down. So I think that'll be specific to HIV.
Yes.
And if I may add, and I'm gonna have to recuse myself
Yes,
from it,
ma'am. I
but
know you got
also,
the CEO.
also, they have to do confirmatories. They have to confirm that those tests are true, and it all has to be recorded with Metro Health. So for the city, they have the numbers and documentation of individuals. So anybody that gets a new diagnosis has to respond and refer that information to Metro Health so they can keep account of it. So,
Where do they get the diagnosis?
right, with the newly
It's
diagnosis.
reportable.
Right. So all of that can be reported and documented.
And Nashville Cares, they'll work.
Yes, Streetworks, Nashville Cares, First Response, all of them may be able, they utilize the services for the staff that's going to confirm the tests that those agencies may have.
Well, thank you. You got it right from this. My friend said the horse's mouth. You heard me? So okay, so thank you so much for that. And how much money was it?
This way.
$54,000.
$54,000. Are there any more questions or comments? Okay, so, and I think also tonight, isn't tonight dining out for HIV and AIDS? For those people that want to go eat, money goes to those organizations. I would do it, but I'm here. I love to dine out for that, so.
I'll put a plug in for Anthony Davis's East Nashville Beer Works. It's participating tonight.
Okay,
okay.
so we can maybe still join that. So that's really important, and especially the work, and I think you said you mapped it out. I know that some areas are higher. I think it's a little bit higher amongst African-American males, young African-American males, which is, yeah, we really want to kind of get those numbers under.
It's been a persistent problem.
Yeah, so, especially in 2018, right? We're supposed to be going the opposite way.
Well, and we could talk about this all night, but there are y'all familiar with the U equals U? I think I sent you that resolution that the Board of Health passed that if you can get the viral load down to a certain point, you cannot transmit the disease sexually. And so people can have normal lives as long as they get treated and keep their viral load suppressed. So
And they
it's-
can
it's
take
not-
prep.
Prep.
Prep is
It's
what,
not
that's
nearly
really
the
good.
distance that
That's a pill every day for the rest of your life.
Right, you take the
Cannot miss
pill
that
and
pill.
it prevents you
You will
from
not
being,
get it, yeah.
it's kind of like a birth control,
Oh, okay.
you know, but
So,
it's,
yeah.
controls the,
It's an odd
Passage
disease in
of
the sense
the
of treatment is prevention.
and too, with the new needle exchange, that's also one of the reasons why, because you find people, now that the needle exchange law is law, you know, you run into those incidents where you find those new diagnoses.
And what's the needle exchange law?
You know,
What is it here?
It's now law that you can actually do needle exchange where people can get new needles.
Clean ones.
Clean needles.
Okay, yeah.
Yes.
Okay, good. And then where would they go for that?
All over. I mean, you can call Streetworks and someone can help you right away.
Okay, very good. I just wanted people to know where they can get it.
Yes, I just have to throw in a plug. The Streetworks was the
Streetworks,
very
that's some really
first
good work.
certified program in the state of Tennessee for the needle exchange
And that's
program.
very important.
And Tom and Mental Health has been very instrumental in making sure that happened, because there has to be disposal, and they have been a partner with Streetworks, and I think
They're bringing us 4 2.5 gallon containers on average a week of used needles.
right. And how many did you used to have?
Well, I mean, we have the ones we use in the clinics and whatnot.
Right,
We
and how
used
much
to
was-
take them from the street like
Yeah,
that.
they usually have, it'd take them a month to get as much as they've been getting a week.
And that's good, because I know with the rise of opioids, more people are using
Absolutely.
needles.
That's how you heard my
Tennessee.
first got to know each other serving on a board concerning HIV in Middle Tennessee.
We sure
so
did.
Yep.
Good.
Some
deal.
years ago, almost 10 years ago, in
Yeah.
fact.
You ladies must have started when you were 12.
We did. How'd you know?
All right, I think we're ready to vote.
Yeah.
Yeah.
Okay, how many are for? All right, seeing none against and one recusal is recommended
Yes.
for approval to the committee.
So,
All right. So the next resolution is 2018-1146. Sponsors Vercher, Gilmore, and Roberts. It accepts a Rachel Ray Save Them All grant from the Best Friends Animal Society to Metro Board of Health to provide funds to have a heartworm treatment program. That's a really big deal.
Yeah.
May I have a motion?
So moved.
Is it moved and properly seconded?
It has not been too far in the past that if an animal came to the shelter with heartworm, it was basically a death sentence. It's treatable, but it's semi-expensive to do that. We didn't have the resources to do that. So this grant and others like it allow us to have those animals treated, and then we can get them placed with either adoption agencies or individuals that come in and adopt them.
Okay, so I thought you were saying citizens can come in and get their monthly heartworm pill for their dog. They can't do that?
This is for an animal that comes to us. So it's not for veterinary knowledge, it's an animal that comes to the shelter through whatever mechanism that has heartworm.
Okay.
We can get it treated so that it is then adoptable.
Gotcha. So I have to tell my
So
friends they
don't
cannot
bring
get.
the dog in and say, leave them a heartworm treatment. That's not
Prevention
what-
is also expensive.
Oh, yeah,
You have to
exactly.
have to ask Rachel Ray
so
about that one.
off the street, basically, you're getting the animal off the street, basically.
If somebody brings it to us, or, and there also, if somebody brings it to us and they're trying to surrender the animal, sometimes it is for medical reasons, if we can try to help them with that too.
Okay.
It's still a good program. That is expensive.
I'm sure
So
that
expensive.
it wouldn't be hard to assume that someone is surrendering an animal that they prefer to keep but cannot keep it well, that you can get it well and then they can readopt it after
And
an
it's not just,
analysis.
yes, and it's
Yeah.
not just heartworm, there are other behavioral issues, health issues, we try to do that with them.
All right, we're ready to take a vote. How many for? Seeing none against, is recommended to the full body for approval. 5 for and 0 against. All right, this is the last one. It's Resolution 2018-1147. Sponsors Vercher, Gilmore, Allen. It appropriates grant funds from the Tennessee Department of Human Services to the Metro Action Commission from a community service block grant to provide a range of services designed to assist low-income and homeless individuals achieve self-sufficiency. May I have a motion?
So moved.
It's been moved and properly seconded. We have Mr. Marvin with us.
From Memphis.
Yes, sir. Would you like to tell us about the program?
Yes, that's the Community Services Block Grant Program. And like I stated in Budget and Finance yesterday, the program used to operate on a July 1 to June 30th fiscal year, but now our funder is going to an October 1, September 30th fiscal year, which is federal fiscal year. The Community Services Block Grant Program assists with rent, mortgage, property tax, basic necessities for low-income residents in Davidson County.
Okay, so you just said something that I thought was pretty important. I didn't know. You had to tell me about that.
Yeah.
I heard property taxes.
Right.
Yeah.
Yes, we do property tax assistance for seniors.
Really?
Yes.
So, and this is in addition to what the city does?
Yes, ma'am.
Really?
Yes.
Okay, so can you tell me more about that? So is it age? What's the requirement? Because I really never knew
Age
this.
is 62 and
Okay.
older. They must have the property in their name. And we work with the trustee's office on getting the payment directly to them to assist the resident as it relates to making sure their property taxes are paid.
Okay, and so they can come any time of the year?
Yes, ma'am.
Okay.
And so
we
it's,
want
how do
one-time
y'all
assistance.
promote that?
One time.
It's on our website. And then we work with the trustee's office if they have someone who is delinquent and they don't have any other means. We work with them as a referral. They refer individuals to us that would need that assistance.
Okay, yeah, I think we probably need to promote that more. That's
Right,
really
I
good. That's
think-
the first
yeah.
time I ever knew that. And
Yeah,
this is in
we get a lot of
addition to
people,
the city.
January, February, we get quite a few individuals that come to our office for that.
Wow.
I didn't know
Okay.
that either.
That's wonderful. And it comes through the block grant from the federal government. This is
Yes, ma'am.
different from MDHA or something else. This is you guys' own money that you've applied for through your department.
Right, this is the 1.2 million that we get every year through the
Okay.
Community Services Block Grant. It is a federal pass-through through the Department of Human Services.
Okay, very good.
Is this at risk right now with the cuts that the administration is making?
We'll zero it out every year in the federal budget. But we always come back.
Every year is risk.
Every year, yeah.
Right, no, but I'm saying in terms of the president who's looking at reducing many of the community block grant funds, is this one of those programs that may be affected by it?
Yeah, we're always on the list, but then again, every
Yeah,
year
it comes
we
through,
have
right?
funding.
It comes
Yeah.
through.
Same thing, and I think that's what you were alluding to yesterday about the low-income home and just
I was.
assistance program. Yes, we've been zero out under just about every administration, but every year we have funding
Okay,
available, so.
okay.
Yeah.
Well, thank you, Mr. Cox. We appreciate you. Are there any more questions? All right, seeing no more
And
questions.
that's Memphis, Hamilton.
Okay. Mr. Cox, you are all right now. You're getting So how many? 4?
We're gonna shut him down.
All right.
So I need to confer with the group now since he wanna come that way. Do we wanna have a private meeting and
Okay, so it is recommended for approval. And this concludes our meeting. I think Mr. Sharp wanted to give us an update from the state legislature.
The state legislature is on the verge of passing a bill that eliminates vehicle emissions testing everywhere. The only place that can keep it, if it so chooses, is here, because we run the program here as opposed to the Tennessee Department of Environment and Conservation, which runs it everywhere else. In order to do that, which we would certainly hope you would look favorably upon and agree to do, you have to vote within 30 days of the passage of the bill. So there's a resolution that's drafted. We will file it for the next meeting whenever the bill becomes law, for the next council meeting after the bill becomes law. So I wanted to talk to you about it now because if anybody has any problems or concerns or questions about it, I'd like to go ahead and clear those up if we can, because when it gets to you, we're going to be short on time.
has this been approved by EPA?
The way the state law is written is the contracts that are in place will finish out. So we'll have a program in place through 2022, June of 2022 regardless. And the state's ends, their contracts end in 19. And it says you can't renew a contract or begin a new program after a contract expires. And that will have to go into the state implementation plan and go to the EPA for approval. So all of that will be, it'll have to go, yes, it will eventually have to go to them. And we've got some other changes that we're making to the program that we will have in there that will need approval from them too.
So is TDEC the one that's pushing this legislation?
No, they were not particularly happy about it. It came out of Hamilton County. And so our feeling is that if this program is eventually, we decide that we don't need it anymore, that it would be more appropriate for this body to make that decision than for the Hamilton County Legislative Delegation to make that decision.
Ah, the plot thickens.
Interesting.
No.
I mean, considering that we've got this transit referendum on,
May the 1st.
right. That's interesting that that's not going to be.
There was a great deal of very poor information that was shared with respect to this at the State House.
Okay.
Yeah.
Well, thank you, Mr. Sharp, for giving us the update.
Thank you.
We have also, Mr. Overlock with us. Do you have anything, any updates or anything you just care to share from the hospital authority
I
since you're
think
here?
you know that, of course, our patient care model, chronic care model, we use the patient-centered medical home, and there's a national body called the National Committee on Quality Assurance, NCQA. And so a couple years ago, we got the level 2 designation. The highest you can get is level 3. So a couple of 3 months ago, we got level 3, which means we're producing good results. And Dr. Webb's next goal is to then create the second type of patient-centered medical home, which is specialty care services. So we'll be pursuing that kind of certification as well.
Wow, when
That's
was
awesome.
the PR on that? That was pretty awesome.
What
That's
about,
really awesome.
is the hospital authority aware of that, and what do they think of it?
I think we've made them aware, so just
Yeah.
So we have a number 3, which is the highest.
highest level.
That you can get, and it's the NHQC?
So NCQA.
NCQA, I had that all wrong.
It sounds like some sort of basketball.
Yeah.
NC, and it's the National Quality,
National Committee on Quality Assurance.
okay, National Committee on Quality Assurance. Okay, thank you so much. If there's no more questions or comments, I'd like to thank all the committee for being here. This concludes our committee meeting. Thank you.
Good.